In what ways will the robotization of cardiothoracic surgery affect the surgeon and their patient? So there are two types of heart surgery. The first one is open heart, and that's when the doctor split the chest and hold it open to gain access to the heart. And the other one that they commonly use is minimally invasive, and that's when surgeons make a small incision right about here. I think it's 3 centimeters, and they send in a robot with 4 arms and a camera to look inside and fix any problems. And so this quote from source F is basically saying that certain animals have senses that allow them to adapt to their environment better. Like for example, bats have echolocation so they can hear, and eagles have increased sight so they can see stuff far away. And if humans were able to adopt that for medical science and surgery, then they could do much better and know a lot more information beforehand. And so I'll be talking about this in the next video. So the first subclaim is that surgery success rate will increase. Source B has a section where it's basically talking about how rescue workers, if they are able to send cameras into the search zone beforehand, they'll know exactly what to do and not be in as much danger and know what to look for and where to look. And surgery is the same way. So with the robot, since it has a camera on it, the surgeons can survey the area and look for exactly what they need beforehand. And also there's a computer monitor up about here on the robot that displays patient vitals. And so the surgeon can react to any changes that this computer displays. The second benefit this will cause is better communication. So the same screen that shows patient vitals will show exactly what the surgeon is seeing. The surgeon looks through a computer in a terminal, and so if everyone sees the exact same thing, they'll all be on the same track. And the third thing, heightened senses, relates back to the quote from source F. Basically, since the surgeon is much closer to the screen, they'll be able to, and since the screen has such good graphics, it gives better visuals than the human eye can achieve alone. And it also gives greater depth perception. And so, the only problem with this is that tactile perception will decrease since the surgeon isn't actually using their hands, so they won't feel as much pressure. But since the audio-visual components and their other senses are so good, tactile perception won't matter as much, and also tactile effectiveness increases because the robotic arms have 7 ranges of motion, which is more than the human wrist. And they correct for surgeon hand shakiness, and they have smaller blades for more precise cuts. The second subclaim is that robotic surgery will make patient lives easier, and this is the ultimate goal of surgeons, so this is why this is so important. All these benefits have to do with the fact that the cut is much smaller, and also in minimally invasive surgery, they don't have to break the sternum, so the patient can heal easier. First, there's decreased blood loss, so not as many blood transfusions are necessary, so when people donate blood, this can go to people who are more in need. The second thing is faster healing. And since they don't have to, their chest doesn't have to heal or their ribs, and neither does the incision, they won't be in the hospital as long. And this is important because, according to the 2018 report by the AAMC, up to 16,000 physicians, or there's a shortage of up to 16,000 physicians, and this relates to the amount of demand versus how many there are. And so, if patients aren't in recovery as long, there will be more available rooms for more surgeries, also more nurses, and stuff like that. And then the final thing is less risk of infection because of the smaller incisions. And so surgeons won't be sued as often, so they can actually do their job. And this picture right here just shows how much bigger the scar, and that's it's not that easy to see, but this one's about this big, and this one's about that big. So the only issues, as stated before, there's decreased pressure, but so told you there's workarounds. And the second thing is increased setup time. Carting the robot and then putting everything into position is a little bit difficult, but as surgeons implement this more into hospitals, this will be the main thing they need to fix first. So the time will decrease, and then as surgeons get more used to it. And so for the resolutions, hospitals and medical schools should put more practice robots or actual robots in their establishments, and that way residents can get more hands-on experience. We should still train surgeons in open heart surgery because some surgeries are too big to do the robot with. And then the final thing, put more research into and development into the technology. This is obviously important because sometimes the medical robots as of now have malfunctions, and there's only currently one developer, which is Da Vinci. So if more hospitals are making different robots and they're all competing, they'll be competing to make the best one possible, and so that'll increase the amount of technology there is. We're excited.
Okay, Jack, one question for you. What advice would you have for other researchers who consider this topic?
I'd have them look a little bit at the economic lens because, like I said, with the competition, there's a lot of stuff that revolves around that, and it's honestly important to look into how much this would cost because when I talked about the resolution, like implementing the robots into hospitals, this is very difficult to do with the amount of costs. I think robotic surgery right now costs a lot more than open heart surgery too. And so they could look at other